Hello, welcome to My Life in Spain. My name is Mark, and today I want to talk about healthcare here in Spain. Now, what sparked this idea is that tomorrow morning I have to wake up early at 7:30 and go to the local health center to have my blood work done. In Spain, that's called analysis de sangre, or most people just say analysis. But the way it works is the health center opens at 8 o'clock in the morning. So you want to get there before 8 o'clock and make sure you're in line. There's never that many people, but it could be, depending on the time of year, whatever, 10 or 12 people in a line. If I get there at 7:45, I'll be like number 4, number 5. Now, once the doors open, you walk inside, you go to the first window, you give them your paperwork, and they give you the, what do they call it, test tubes, I guess, with a barcode on that matches your name and number. Then you take the test tubes and you go around to the next door, and inside they have it set up like an assembly line. There's 5 desks, 5 nurses, and you walk in, sit down, they pick which arm they want, you roll up your sleeves, they take your blood, give you something to put on it, you walk out, the next person walks in. It's really, really fast, and it's a great system. I've never seen it anywhere else before. It's really, really good. Now, I'm on the public health care in Spain, which means I don't have private health care. So I don't pay anything. And the reason I'm on public health care is because I had a business here and I paid into it. Now I'm retired. I don't have to pay anything at all each month to continue having the health care I have. And I must say, I'm extremely happy with it. It's very, very good. I've got no complaints whatsoever. So once I'm finished with drawing the blood, I'll go to the desk reception area in the healthcare center, and I'll make an appointment for a week later to see my doctor. And then I'll go in to see the doctor, and the doctor will discuss the results from the blood work. Now here, everybody on the public healthcare system has what they call a SIP card. It looks like a credit card, but it has all your data on it, all your health issues, everything on this card. So all they do is as you see on the back, it's got my doctor's name and what have you. They just scan it, slide it in a reader, and all my information comes up. It's a great system. So when I go to visit my doctor for the results, I walk in the health center, I put my card in the machine, and the machine gives me a ticket with a number on it. And the number will say what door I have to go to and what number I am in the queue. Now, I've never ever waited more than, I'm going to say, 10 minutes to see the doctor. And you sit down, there's a TV screen, and it's got, once your name pops up and your number, they don't use your name, they use your initials, but your number pops up, you go to the door, it says on it. My doctor's always in door 25, so I already know where I'm going once I walk in there. Now, if my doctor is not happy with the blood work results, or he wants me to have more tests, he'll send me to see a specialist. Now, all the specialists are in the hospital, which is about probably not even 500 meters away maybe. So then he'll make an appointment for me there, or they'll call me from the hospital to tell me when my appointment is and which doctor I have to go see. It's a really good system. This card as well, when you get prescriptions, all you do is go to the pharmacy, give them your card, they put it through the reader, and they see exactly what prescriptions you need to have. And then they give them to you. Now, unlike America, there's no copay, but we do pay a little bit for prescriptions. I think we pay 10%. But because drugs are cheap here anyway, it's really not much. Sometimes I can pay, like I have a thyroid condition, and the pill for a thyroid for like a month cost me like, I don't know, 57 cents or something. So it's very, very inexpensive. Anyway, tomorrow what I'll do after I'm done with all the blood work and I go home, have something to eat because I can't eat after midnight, obviously. I'll take you, show you the health center, and then from the health center, I'll take you to the hospital. So your doctor that you're given is always in the health center. If you're not happy with the doctor, you can always change them and ask to see somebody else. If he recommends you go see a specialist, all the specialists are in the hospital. And the same thing goes. You put your card in the machine, you get a number, and you sit there and wait to see what room you have to go to. I'm very, very happy with the public healthcare system in Spain. Here it's about prevention. It's not about getting sick and going to the doctor. You go anytime you feel like going because it doesn't cost you any money. I mean, I make it a point of having a checkup at least once a year, and having my blood work done. Great, I'm happy with that too. No problem, because that's an early indicator if you might have something wrong with you. So it's preventive healthcare, which is something unfortunately it's lacked in America because it costs so much money. Also here, the ambulances are free. If you need an ambulance, it's free. You dial 112 or you push the buttons 112. Tell them what you need and the ambulance will come and get you. You pay nothing. If the hospital here where we live in Alcoy cannot treat you, and they can for most things. I mean, my mother had a hip replacement there. There's not too much they can't do here, but if it's like something critical, they'll medevac you to Alicante or to Valencia. And if it's time dependent, they'll medevac you with a helicopter. So it's a really, really good system. And the fact that I never have to worry about what do I do for healthcare if I lose my job, or if I'm retired, how am I going to pay for Medicaid or all this stuff. I don't have to worry about it. It's a big peace of mind. Anyway, tomorrow I'll take you to the healthcare center, show you what it looks like, and then from there I'll walk down to the hospital and show you the hospital and the emergency room. The emergency room's open 24/7. So if you need to see a doctor when the clinic is closed, you just go straight to the emergency room. Again, no charge. Nobody's going to ask you for money. Nobody's going to ask you for insurance. You don't walk in the doctor's office here and see a bunch of people doing billing. It just doesn't work that way here. It's a much better system, and I really wish they would do something like this in America and stop gouging people. I had a hernia operation in America, so I was in hospital for like one night, and my thyroid doctor paid a visit to see how I was doing. What the hell's he doing there? You know why he's there? Because he can make money. He can bill the insurance company for coming to visit me. It's all wrong. It's all wrong. It really is. Healthcare should be free everywhere, no matter where you are or how much money you have. Anyway, that's just my rant for now. I'll finish this video tomorrow by taking you and showing you where I have to go. Okay, hi, good morning. It's about 10 to 8, so I'm a little bit later than I wanted to be. But we're going to go for a walk to the Centro de Salud, the health center. And I'll get my blood work done. I might go home and go back to bed, I don't know yet. And then I'll take you to the hospital after when I wake up the second time. Okay, we're at the hospital now. I would say from the health center it's about 500 meters, maybe less. So this hospital is the regional hospital here in Alcoy. So it's a hospital for the city of Alcoy and the surrounding villages. This is the emergency room that's open 24/7. And like I say, if you need to see a specialist, all their offices are here. Nobody has a private office. It's public health. It's regular doctors are in the Centro de Salud, the health center, and the specialists are all in the hospital. So that's the emergency room, emergencies. Okay. We'll go down to the general admissions part of the hospital. I'll take you in there quickly. Have a look. As I mentioned before, ambulances it's free to use an ambulance here. If you need one, you just dial 112. Tell them where you are and they'll come and get you. I remember when I worked in America, it was so expensive that if people needed to go to the hospital, they'd say, no, don't get me an ambulance, get me an Uber. It's kind of ridiculous when you think about it. Okay. So this is the general admissions. Quick walk down. Hola Beatrix, buen día. Bien, bien, ¿y ti? That's one of my neighbors, she works here. So that's always handy as well. You know somebody in the hospital if you need to go somewhere or do something. She helps you out. Okay, radiology. This is the reception for the hospital, and these are the elevators for the different floors. Take you inside quickly. Now there's this screen I told you about when you wait for your name to come up, and then it tells you what door to go to. Okay. Okay, so that's the tour of the hospital. I just looked at the time on my phone. It was 8:26. So from the health center opening at 8 o'clock and me walking down here to the hospital and through the hospital to show you what it looks like, it's 26 minutes. So not very long. It just goes to show you how efficient the system is here and how well it works. Anyway, if you like these kinds of videos and you want to learn more about what it's like to live in Spain, please subscribe and I'll keep you updated with new things. It's going to be about food, it's going to be about travel. We're going to do all kinds of stuff here together just to show you what it would be like if you lived here. Anyway, thanks for watching and I'll catch you in the next video. Bye for now.